Good afternoon. I'm Dr. Alnita Jackson, and I'm an assistant professor at Fayetteville State University in Fayetteville, North Carolina. I'm also a certified nurse educator and a board certified family nurse practitioner. Thank you for the opportunity today to present my work from my doctoral program titled Interprofessional Collaboration, the Implementation of an EHR in an Orthodontic Dentistry Practice to Improve the Referral Process. These are some of the objectives we're going to be covering throughout the presentation. We're going to discuss the state of oral health in America. We're going to discuss the role of interprofessional collaboration in healthcare. We're going to discuss the significance of the use of electronic health records, their advantages and their disadvantages, and their implications for practice. Perhaps like many of you, when I entered my doctoral program, I had no idea of what research I wanted to conduct or what clinical practice improvement that I wanted to undertake. So for me, my aha moment happened simply by chance. My daughter was referred to a local orthodontist for braces. During that consultation, a set of x-rays were obtained. The x-rays revealed that my daughter had 2 extra teeth in the back of her mouth. So now my daughter needed a referral to an oral surgeon to have those teeth extracted before her braces could be applied. So to my surprise, the orthodontist pulled out his prescription pad and promptly wrote her referral on the pad. So a couple things went through my mind. First, did he really just write her referral on a prescription pad? Apparently, he doesn't have a formal referral process in place. And so as I looked around the office, I saw that his walls were littered with paper charts. So the light bulb went off, and the idea began to formulate in my mind that perhaps this is an opportunity to collaborate with this provider and bring him into the 21st century and introduce the electronic health record into his practice. It has been said that a picture is worth 1,000 words. Since I have a short amount of time, I thought these pictures were great visual aids to represent what I saw within the practice. As I previously mentioned, antiquated methods were being used. The provider is writing prescriptions on a prescription pad and also referrals. And as you can see, paper charts are still being used within the practice. It brings a lot of frustration for the staff. It takes them a lot longer to do their jobs because they have to go and pull the charts to find out what services are going to be rendered that day for the patient according to the treatment plan. It makes the patient have to wait a lot longer. So there's no clear guidelines as to what should be done. There's a lot of confusion. Referrals are being lost in this manner. I actually lost my daughter's referral and had to go back to the practice to get another referral. So there are a lot of problems with this because on that prescription pad, the patient's name, their date of birth, and the services that they're being referred for are actually on that prescription pad. So that poses a problem. That's a breach in patient confidentiality. It also causes delays in treatment because I had to come back to the office to get another referral. So that took another 3 or 4 days before I could get the actual referral for me to get back to the office to pick it up. The other problems with this is that it shows that there is no formal tracking system of referrals. So if the patient doesn't actually go and have the services performed, how do they know that they've actually been done? And also, if the patient does get the services performed, how does the patient know when to come back to the clinic, or how do they know when to contact the patient? So there's a lot of gaps in services here, and that has to do a lot with the referral process. So based on what I saw in the practice, it needed definitely an intervention. So the intervention is EHR to the rescue. The purpose of this project was to prevent unnecessary delays in treatment, increase access to care, and provide continuity of care by implementing the One-Touch EMR, an electronic health record system with the capability to generate and receive referrals. Some secondary gains of this of this project included increasing care coordination between providers, increasing patient access to health information, and also improving patient satisfaction with orthodontic services. The One-Touch EMR was selected for implementation in this practice because it is considered a certified electronic health record, which means that it has met the requirements set forth by the Secretary of Health and Human Services in terms of capability, functionality, and security requirements. And it has also been certified by the Office of the National Coordinator, and this is of particular importance because it affects reimbursement for Medicare and Medicaid services. One of the objectives that I wanted to cover in this presentation was the state of oral health in the United States, so that we know that it's not just a local problem, but it's actually a national problem. And according to the World Health Organization, globally, 60 to 90% of school children and nearly 100% of adults have dental caries that requires care from a dentist or often prompts a referral to a specialist. As you look at the slide, you can see that these are some pretty staggering statistics that poor oral health has resulted in 100 million specialist referrals. And out of those referrals, only 50% actually get completed. So there's miscommunication or there's missing information that prevents the referral from being processed. And also there's breakdowns in the referral process, or just like in this orthodontic practice, there is no referral process, which leads to delays in treatment and negatively impacts health outcomes. The theoretical framework that guided this project was LEWIN'S change theory. In this theory, there are 3 stages: unfreezing, changing, and refreezing. The overall theme of this theory is that most people are comfortable with the status quo and resist change unless there is a driving force that necessitates that change. This theory is relevant in understanding how organizations not only shape but grow in accordance with new behaviors of individuals within the organization. In the unfreezing stage, unproductive or undesired practices are replaced with new methods. In this case, it will be the implementation of the EHR. During this phase of the project, educating staff, challenging the status quo, all become very important. In the changing phase, this is when the attitudes and behaviors start to change as they are introduced to the benefits of using the EHR. And then in the refreezing stage, this is when the desired behaviors or new behaviors are adopted into the practice. As I was conducting my research for this project, I found several articles that demonstrated the prevalence of oral disease in the United States and its effect on millions of Americans, and not only for oral problems, but also its impact on chronic diseases such as diabetes. So for diabetic patients, hyperglycemia may result in periodontal disease. And also with patients with heart disease, particularly heart defects, it may lead to endocarditis because of bacteremia. And also in pregnant women, it contributes to premature births and low birth weight. And also within the literature, in relations to EHRs, it found that providers who use EHRs, they were able to share complete and accurate information from remote locations around the world. And that it just provided an ease of accessibility to patient record, that it aided in diagnosing patients, reduced medical errors, and just made the transition for patients a lot easier. And their electronic referrals were also easier to access and to process, and they actually had follow-up with their specialist. Interprofessional collaboration was a key element in the success of my project, and also is important in the literature. According to Moore, increased awareness among medical and dental providers regarding the connection between oral health, systemic disease, and overall health and wellness has given rise to an emphasis on interprofessional collaboration. And through our collaborative efforts, we can promote health and we can increase patient outcomes. Historically, nurses have tended to work in silos, so this interprofessional collaboration or a multidisciplinary approach actually provides holistic and patient-centered care. My project was implemented in a privately owned orthodontic practice in Fayetteville, North Carolina. And in this practice, he was the only provider, and he saw approximately 25 patients daily. The clinic had 4 exam rooms and a patient consultation area. Patients were seen in the clinic Monday through Thursdays, and then on Fridays, they had a day for administrative needs. And if they had been using an electronic health record, there probably wouldn't be the need to set aside a day just for administrative needs. All the documentation could be done in the electronic health record. The patient population that was seen in this clinic was racially and socially diverse. The orthodontist treated patients between the ages of 7 up to adulthood. As you can see, this project took place over a 6-week period, and each week I had specific tasks or things that I wanted to accomplish with the staff. So in week 1, I met with the staff and found out what their different roles and responsibilities were. I also gave them a questionnaire just to kind of find out if they had ever worked with an EHR and if they liked working with an EHR. And after we did that, I actually did a PowerPoint presentation on the One Touch EMR so that they could become familiar with it. And the second week when I went back, we discussed the pros and cons of the electronic health record and whether we wanted to adopt it into the practice. And because I've had administrative rights to in the One Touch EMR, I created all the accounts for all the staff members, and they all had different accesses based on their roles within the clinic. And then I set up their trainings, and they began their trainings that in week 3. So in week 4, they were expected to complete their learning modules, and they did do that, and they were expected to be able to input patient data into the EHR. And then in week 5, I came back and I sat down with each individual and we did face-to-face training, and they learned how to create referrals within the EHR, which was a big deal since that's why I was really there, because they had no real referral process. But also during that time, I also created templates for the clinic specific to their needs, because an orthodontic practice, their needs are different from what I might need in primary care. And so in week 6, went back, the staff completed their questionnaire as to whether they wanted to adopt it, did they find it user friendly, did it make their job easier? And those were some of the questions that were asked. And then after that, I actually sat down with the practice owner. We talked about the EHR and whether he thought it was feasible to adopt it into his practice. The One Touch EMR was selected for this project for several reasons. First, it was a certified electronic health record. This will become important because it would allow this particular provider to start seeing patients who had Medicaid so that he could be reimbursed for his services. We also selected this particular EHR because basically with the basic features, it was free. It only incurred costs as you added more providers and more features, and also because it was easy to download onto mobile devices, tablets, and Androids. And it also worked with Microsoft operating systems. And it also had a cloud-based platform that for data storage, and also allowed document exchanges with major healthcare systems, and also allowed interoperability among users. And the creator of the One Touch EMR is also the creator for eClinical's Meditex or NextGen, if you may be familiar with some of those other electronic health records. This is the evaluation plan that I used for my project. I used observation and feedback from the staff on the EHR, whether it was advantageous or what disadvantages that they find in using the EHR, and whether or not they wanted to adopt it into practice. And also, as the administrator for the One Touch EMR for the clinic, I was able to go online and access their information and make sure that everyone completed their online training and their modules. And also, I did a pre and post questionnaire for the staff. And so to really determine whether this plan was effective, I used to follow in outcome measures. Outcome measure number one was implementation of the EHR will be considered effective if 100% of staff complete training. And the second outcome measure was 67% of staff will successfully input data, including generating a referral into a sample patient chart without assistance by me. And at that time, I was a doctoral student. And then I would discuss with the practice owner whether to adopt or continue use of the EHR in his practice. This pie chart represents the findings from the online trainings and the demonstration of being able to input the patient data into the chart and be able to generate a referral without assistance. 75% of the staff were able to do that without a problem, and 25% of the staff needed a little bit more training. So I did a little bit more one-on-one with them to help them to be able to successfully navigate the system and input the data and to generate referrals within the system. This is some more data from my project. The staff were able to complete 100% of the online and face-to-face training. 100% of the staff responded to the pre and post questionnaire, and 100% of the staff wanted to adopt the EHR into the practice. And this project did exceed the outcome measures. 75% of the staff were able to input data into the EHR and to create and generate a referral, and only 25% were unable to do so without assistance. These are some implications for practice. The one-touch EMR can generate and receive electronic referrals and streamlines this process. It prevents delays in treatment, improves care coordination between providers, promotes patient safety, and maintains confidentiality. This system can easily be implemented with minimal cost in any practice setting and may be used globally. This system is also user-friendly and easily adaptable to handheld devices such as iPads and Android devices. These are some of the takeaways from this project. Poor oral health is one of the leading healthcare concerns plaguing millions of children, teens, and adults in the U.S. and developing nations. Preventive dental care and prompt referrals may improve access to care and reduce delays in treatment. An interprofessional collaboration and implementation of an EHR facilitates effective communication between providers and assists in care coordination. This concludes my presentation. Does anyone have any questions? This is a list of some of the references that I used in this project.